So some of the tests that we request for the blood test include pack cell volume. This is to know the level of the blood level of the pregnant woman. It is very, very important because, like I mentioned earlier, anemia in pregnancy could be dangerous to both the mother and the baby. And because of the changes that happen in pregnancy, so like the growth of the womb up to the level of the diaphragm. So it causes splinting of the diaphragm because of the edema, the changes around the airway of the pregnant woman. So all these conditions could easily, and when especially when the woman is lying on her back, it could reduce the blood and cardiac output. So all this will aggravate the effect of anemia in that woman. So it is necessary to know the blood level, and if it is low, it should be treated appropriately. Then the blood type, like I mentioned, the blood group, if it is rhesus negative, we treat appropriately. Infections like HIV, hepatitis B, hepatitis C, syphilis will be screened for. And if there's any, if we detect any abnormality, then we cancel the woman and we take steps to treat so that we can reduce the risk of complication on that pregnancy. So urine tests, we allow us to detect the presence of protein, glucose. Like I've talked about this earlier, presence of protein could be with elevated blood pressure could mean presence of a preeclampsia or gestational diabetic mellitus. So these are some of the diseases, and also it could mean presence of protein in the urine could also mean urinary tract infection. All these things will allow us to manage appropriately when detected. Ultrasound scan to monitor for the fetal abnormalities, both structural abnormality, some pregnancies due to what the pregnant women got exposed to early in pregnancy are prone to have structural anomalies. So this anomaly scan is usually done around 18 to 22 weeks, and when there is history suggestive or that suspicious of exposure to dangerous elements, so we advise pregnant women to do this so that to reduce the possible complication that could come with it, or to detect if the baby has been affected, and such baby will be managed appropriately. Also, glucose screening, I think I mentioned this. This is a oral glucose tolerance test, which we use, especially for people with previous history of gestational diabetic mellitus. So we advise them to do this test so that if, because of the risk of recurrence in the index pregnancy, it will allow us to detect if there is a recurrence, and we'll be able to manage it appropriately. So the group B strep test is usually not done in our environment, but is a good test because it could result to preterm